have patients who comes in complaining of pain over right hypochondrial area, or patients who has jaundice, or some patients in whom you're trying hard to look for a source of fever. One of the sources of fever is hepatic abscess. To look at the liver is pretty simple. You just need to put the probe in this position with the arrow pointing this way, and your movement would be from the epigastric area, and you'll be moving your probe along the subcostal line, like this. You will move it all the way to this side, and along the way you will explore the area of the liver just by tilting it upwards and inwards, yeah, like this, as you move away. That is how you'll be able to explore the liver to look for any hepatic abscess. And along the way you would also be able to look at the gallbladder. Okay, let's try again. So you put in the epigastric area, and then start to move it along the subcostal margin. So I'm moving towards the subcostal margin, and I could already see the liver. This is actually the heart, the liver. You can see part of the gallbladder over there. Yeah. From here you can see whether there is any hepatic abscess. So towards the epigastric area, you will be able to see the left liver node. Yeah. And if you move towards lateral, you'll be able to see the right liver. And along the way, you will be able to explore whether there is any abscess or not. And as you can see the liver already, and you can also make out part of the gallbladder over here. This is the gallbladder. It's a little bit somewhat obscured by the gas shadow, but you could still see it. Yeah. So the gallbladder, you can already make out whether there is any gallstone. If there are stones, you'll be able to see an echogenic structure with shadow underneath it, because the ultrasound, the sound wave can't travel across the gallstones. And one easy thing to look at is the gallbladder's wall, because when we talk about cholecystitis, inflamed gallbladder, when you look at the size of the gallbladder wall, 4 millimeters or more, you are thinking of a cholecystitis. And you could measure it side to side, the wall. Here the wall is about 3.1 millimeters. Yeah? And at the same site where you can visualize the gallbladder, you could actually press it, and if there is a cholecystitis, you can get what we call sonographic Murphy sign. Patient will just stop breathing as you press it. So that's how you can explore the liver along the way up to this area. From here, you'll be able to see you can see part of the kidney, and this is the liver. And you can also see patient's diaphragm, because this echogenic structure above the liver is actually your diaphragm. Okay? And as patient breathes in, you will see that the whole liver will be pushed down, and you'll be able to see above the diaphragm what we call a curtain sign. This is the lungs coming down and obscuring part of the right of the liver.